Hi everybody, I'm Dr. Zainab Bora and I have with me Dr. Vishal who has cleared his DNB practical exam. Congratulations, Dr. Vishal, first of all. So
Thank you, ma'am.
tell us about yourself. How has your journey been like?
Ma'am, I'm literally new to this place, was new to this place. My home is like 1,200 kilometers away from this
Wow.
place. I'm doing residency from Raipur, Chhattisgarh, and I'm from Maharashtra basically.
Right.
So my residency was like very a transformative journey.
Hmm.
It was very challenging, but was equally rewarding also. So, and the workload was moderate. I had very good hands-on in ultrasound and the CT and MRI, and like in every modality,
Right.
and I had good exposure to all the diverse cases, which give me a strong clinical foundation also. And to be fortunate enough, means I had amazing consultants, especially mentioning my HOD sir. He was like a godfather to me during my residency, and I know that he will help me even in future also, because he helped me not only in my like academics or this radiology thing, but also in my like personal or like family problems also. So
Yeah.
he will remain as my godfather. Like,
Amazing.
so residency was like quite good in academics and like all other things also.
Nice, nice. Which hospital did you say?
Ma'am, Ramakrishna Care Hospital, Raipur.
Okay. So,
It's
when you were going to join the hospital, take us back 3 years ago. What was your thought process and why did you choose this particular, institute? What were the things that had checked off the list that, you may have had when you wanted to do radio?
Ma'am, to be honest, Ramakrishna Hospital was not in my list, was
Mhm.
not in my primary list, I can
Yeah.
say.
Yeah.
But I got this hospital in my third round, like in mock-up round. And I was like, I have to go to this hospital. I have to, like, I had no other option.
Yeah.
And so I came to this hospital and I first met my HOD sir, and like he made me make sure that you are in the, like, I am in
Mm.
the very right place for
Yeah.
not only academics but in all other things. Like Raipur is
Mm.
a great city to live, and the academics and the staff and the modalities and everything was like it was like what I wanted.
Yeah.
So yeah, if I'm completing this 3 year residency, and I can say that I made a very good
Mm.
choice,
Good.
even though
That's
it
nice.
was not in the
Yeah.
primary list. Yeah.
Yeah, so some things
Yes.
happen for a reason, and in the end,
Yes.
as long as you've learned, and that is what these 3 years are for. They are for your skill building, and if you found friends in the process, that's a bonus. So
Yes,
that
ma'am.
is something which is great. So if we can talk about the exams, how did you
Yes.
approach the theory and the practical exams? What was your thought process? How did you use conceptual radiology? How did that play a role?
Yes, ma'am. Actually, conceptual radiology made a like had a huge role in my theory as well as practical preparations, because it not only helped me in my exams also, but it helped me in shaping me as a radiologist that I am. That you and all the faculties simplified even the toughest subjects by breaking them into logical and easy to understand concepts. CR also helped me identify my weak areas, and more than just exam preparation, it changed the way I approach cases in daily reporting. And about the theory examination, I use the standard textbooks, and I used to make concise notes from them and then refer back to CR and all the videos and then the notes of the CR,
Yeah.
and then note down everything that I think that it will be helpful in my exam preparation or my theory or practical exam. And I made sure that I used to solve like 50 spotters daily, even though in my first year, starting from my first years. So it helped me a lot. Like in practical exam, spotters will help you in like clearing the OSCE
Yeah.
questions. So CR and all the standard books will help me in this. preparation,
That's
yes.
great. That's great. So, you were a regular student throughout the 3 years. Would you take out
Yes, ma'am.
time
Yes, ma'am.
to, whatever case you are reporting, would you study that at that moment, or did you have a fixed schedule of reading various books or watching videos? How did you go about it?
No, ma'am. Like if I'm seeing a case in my
Mm-hmm.
daily schedule, like if I'm seeing pancreatitis, then I will go back to
Mm-hmm.
home, and whenever I'm getting time, I will search it on conceptual radiology. I will study it thoroughly on that app. Then I will use other journals like RSNA or like radiology assistant.
Yeah.
So I used to follow this in my entire residency. That if I'm seeing a case, I have to read that case
Yeah.
afterwards.
Yeah, that's the best habit, I think, that way
Yes,
you can go back and see the case again with a different perspective and see a few things which you may have initially missed. So I feel that's the
yes,
best way to study, on the job, see the cases and, keep referring to various sources
yes,
and integrate it. And that stays with you. You don't really have to, go back to it during the exam also. Somewhere you've read it thoroughly, it all comes back during the exam.
yes, ma'am. Yes,
Yeah.
ma'am.
So if we can talk about your practical experience, there is
Yes,
a general perception that DNB practical exams are very, very tough to crack. So what
yes.
was your experience like, and did you also have that fear, that failing rate high hai? So what was your fear or the challenges with the practicals?
Yeah, ma'am, my practical exam center was Sir Gangaram Hospital, Delhi, and it had not like very poor reputation of this
Yeah.
passing students. So I had the fear,
Mm,
but I practiced like my department made me like they give me around 2 months of leave, well, like 1 month of leave before my practical
mm,
exam,
yeah.
and it helped me a lot. Like they even took my like they even made me prepare for all the cases. We have a case, we have all the cases stored up in our department, and they used to like make us do talk about
Mm,
the cases, do describe the cases,
yeah.
do give our differentials. So it helped me. And the one thing I would like to tell my juniors or whoever will be watching this video,
Yeah.
that do spotters daily, and do weigh on OSCEs more,
Mm,
because OSCEs will not only help you in scoring high,
mm,
but also in like if you are on the verge of like if you are getting 150 marks and like the examiner is more of like whether should I pass or whether, so then the OSCEs will help you. Sure.
yeah. It's a buffer basically. If you can score more,
Yes,
your weightage of the Viva goes a little, down. So that is
yes,
always helpful because then Viva is always subjective. You don't know what they are
yes.
going to ask. So what were your cases?
My one case was like testicular mass with
Mm.
multiple lymph node mets, and one was like simpler tuberous sclerosis, complex of tuberous
Right,
sclerosis.
right.
So one case was good, but the second
Mm.
case I was like the film they bought was not of the like greatest quality. So I
Yeah.
missed the testicular mass, but
Mm.
I told them that this is a likely a metastatic lesion from
Yeah.
unknown primary, and they pointed out me that this is a primary.
Ah,
So.
nice. That's good. So what were the OSCEs like? How was your experience with OSCEs?
Ma'am, OSCEs were very good for me and
Mm.
even for my colleague also. And
Mm.
like I had six other students with me, and they also told me like OSCEs were good. But
Yeah.
the we had exams on 12th, and my some of my colleagues were giving exams on 13th, and they told me that 13th was not that easy.
Okay.
So
Okay. So the
yeah,
OSCEs
we
are
were
the
lucky.
same all over India on one day
Yeah,
and then different on the next day. Is it like that?
yes, ma'am.
All
Yes,
right.
yes, yes, ma'am. Yes,
So
yes,
there are two
yes.
set of OSCEs every year.
The two set. Yes.
Ah, all right. Okay. So, okay. Fine. So I think you have guided the juniors, and I think the most important takeaway is that study on the job. As you suggested, practice a lot of spotters because that's something which is an objective assessment in your exam that helps you score, in the practicals very well. And overall, just make friends and make connections because that's what is going to help you ahead in life. I am pretty
Yes.
sure that everyone is going to clear their exams. So it's what comes ahead, which is very important. So what plans now for you?
I'm planning to do a fellowship in fetal medicine.
Mm.
I'm not yet completely decided that I'm
Yeah.
going to do that, but I'm like more inclined towards fetal medicine. So I will do that, and then I will join like any hospital, like fetal medicine hospital, and then will continue on my own.
Amazing, amazing. Wishing you all the very best, Dr. Vishal, and thank you so much for speaking to me. It was a great pleasure.
Thank you,
Thank you.
thank you, thank you, ma'am.
Bye.